And the campaign against stigma continues. Do not stigmatize people living with the virus or who have recovered from COVID-19. They are our brothers, our sisters, our neighbors, people who we live with. Anyone could pick up the infection. Remember that, including you. And you don't expect the world to hate you just because you're sick. Our frontline workers, they are our heroes and our heroines, so let's stop the stigma now. Now, former President John Mahama has described government's handling of the country's COVID-19 cases as chaotic. According to him, the astronomical increase in the country's cases is a reflection of how government has tackled the pandemic. Addressing Ghanaians in an address live on Facebook, the former president noted that the government has been very inefficient, adding the government has also failed to listen to advice from stakeholders because is a cause for Ghana's surging case count.
I wish to emphasize that the present situation we are grappling with could have been avoided if suggestions offered by well-meaning Ghanaians, including myself, were heeded by government. The Akufo-Addo administration refused to listen to calls to include assembly members and traditional leaders in public education about the disease, in distribution of COVID relief items, and in contact tracing and surveillance. The result has been the disorderly and chaotic distribution of food that caused the lifting of the lockdown. Public education has also been abysmal, and understanding of the transmission of the virus is low. Messages in our major local languages are very few or non-existent in many cases. This is reflected in the total absence of physical distancing in our public places such as our markets and transport terminals. Involvement of traditional rulers in guiding surveillance and contact tracing would have delivered positive outcomes because they know their communities well. The consequence of government's decisions born out of short-term political considerations instead of the science of the pandemic has been the rising number of COVID-19 infections and the resultant deaths we're seeing today. From 2 confirmed cases on March 12, that rose quickly to 8,548 on 1st June. Today, 17 days later, we have 12,590 confirmed cases and 66 deaths. Reports that isolation and treatment centers are full make the situation all the more dire. While government keeps priding itself with success in testing and has attributed the high rate of infection to the increasing number of tests being conducted, many have expressed skepticism about the accuracy of government's COVID statistics and gone as far as accusing the authorities of massaging the figures. It is recommended by international health experts that as countries start to ease restrictions, it is necessary to expand testing in order to understand the trajectory of the virus. Unfortunately, a strange directive has popped up, issued by the Central Regional Director of Medical Services, requesting all districts and facilities in the region to halt mass testing and test only in conditions when a patient comes in with suspected symptoms of the disease. This has been interpreted by many as an attempt by government to restrict testing in order to show a slower rate of infection. We all have a part to play, all of us, towards ensuring that we protect ourselves and our family and our colleagues from infection. But it is the responsibility of government more than any other to ensure that our management of the COVID virus is transparent, is people-centered, and is based on the best scientific advice and practice. My brothers and sisters, health is a human right. The outbreak of coronavirus has shown that a strong healthcare system is vital for any country. The provision of modern, well-equipped health facilities with motivated staff will make it easier for you and every Ghanaian to access quality health care. The NDC party I lead has demonstrated over and over again that it does not talk, it delivers. We are guided by deeds and action and not talk.